Jane Lang. I'm one of the senior people business partners, and I have been helping coordinate the flu and the COVID vaccination programme.
I'm Becky Valance, Clinical Lead for Quality Improvement. I've been leading on staffing and running clinics for the COVID vaccines.
Hi, I'm Lisette Cahill. I'm the Education Quality and Governance Manager, and my role has really been about establishing the training requirements and ensuring that we've got safe and effective vaccinators.
A lot of preparation went into the planning of the COVID vaccinations. So we have got experience of planning the flu vaccination campaigns, but the COVID vaccination campaign was very different because of the type of vaccination that we had, which was Pfizer.
The vaccine itself was a big challenge. It had very specific requirements. It needed reconstituting out of a vial, but the vials came frozen and needed specific time to be defrosted and had a very short shelf life once they were defrosted. So we needed pharmacy support to be able to free up the vaccinators so that they didn't have to draw it up and mix it, that they could just concentrate on doing the safety questionnaires with the patients and administering the vaccine. So we had a lot of support from pharmacy to help store it, to help safely prepare it so that the vaccinators could administer it. From a staffing point of view, we asked for volunteers to be COVID vaccinators. We started with the flu vaccinators who were all members of staff, but we were able to take it wider than the normal flu peer campaign because we could offer it out to physios and speech and language therapists and other allied health professionals like ODPs. So we asked for matron volunteers to release a day a week of their time and other members of the senior team to form a rota that covered potentially 7 days a week, but initially 5 days a week, as the requirement for the Pfizer vaccine was that it was used within 5 days of being defrosted. And we set up a rota working 12-hour shifts to be able to maximise our vaccinations over the time period that we had the vaccine for.
So there was a large amount of preparation, as Jane and Becky have said, multi-professional across all of our teams within DBTH. The training requirements were extensive, and as Becky's alluded to, we had a set of peer vaccinators for the flu campaign, which has always been a very efficient and effectively run campaign each year. But the requirements for education were significantly greater. It was very much an unknown situation. Obviously, nobody had given the vaccines before. The Pfizer vaccine, as Becky mentioned, was quite a challenging vaccine to begin with, to know how to handle it safely, how to administer it, how to prepare it. Our pharmacy teams were outstanding in their support and in training us. So as highly experienced nurses, we still required some additional training for preparation of the drug, which we took on board, learning to be the clinical lead and establishing that from a quality assurance and patient safety point of view, which actually ultimately was the optimum goal out of all of this.
Because the Pfizer vaccines came in batches of 1,170, which is quite an exact number, what we had to do every time we got a delivery, we had to try and arrange a clinic and get 1,170 patients or staff members to those clinics to ensure that we didn't waste any of those vaccines. And I think overall we did a fantastic job, where we had comms going out to get people to come. If we had some spare ones, we had the vaccination teams in the clinics ringing up and getting people across from the sites if we had any vaccines left over.
I think one of the other challenges that we had, particularly in the first round of administration, was it was a new vaccine. Whilst it had gone through all the patient safety clinical trials, etc., I think a lot of the role was about reassurance of staff who were attending. And also actually in the 5 minutes or so that you were with them, you were undertaking health and wellbeing opportunities as well. And I think some of the challenge, it did to some degree take its toll on us. You were on a daily basis listening to some, heartbreaking stories of what people had been through during the pandemic. The other challenge, which every vaccination hub would have been environment as well. So not just because of the Pfizer vaccine, but with the COVID social distancing expectations, that put some limits on how many people he could get through at any one time because of the 15 minutes to observe them afterwards.
And asking staff to take part in the vaccination rota was also a big challenge because they were doing it in addition to their day job. So we were asking them to give up a day or 8 hours of their time in what was an already busy day job to then come and support the vaccination programme, which they were really good at doing. So we had in the end 71 vaccinators of different levels of staff, that some that were redeployed, but most were doing it in addition to their day job.
I think the other challenge was as well as the movable feast of which systems we put the information into, was the actual national guidance. So sometimes it could change multiple times just in 1 week, which again, it's a new programme, it's a new vaccine. As the trials went on, as more people continue to be vaccinated, the JCVI, who obviously launched all of that evidence and guidance, updated that. So it was ensuring that as clinical leads we were absolutely up to speed and could support the vaccinators, but that the vaccinators themselves could answer sometimes quite challenging and complex questions that people had.
Getting a list, or a definitive list of people that we needed to vaccinate was really challenging, because the hospitals are made up of not only direct employees but also other support employees, contractors, agencies, NHSP, Sodexo and such, where we didn't have their information, but we needed that in order to get them booked on. So we had to request information from other organisations to actually get people set up on the COVMIS system, which is our internal system for recording the vaccinations. So what we also had to set up for that, because we obviously understand that not everybody is IT literate to the point where they can book things electronically, is a helpline via an email account, which our HR department supported from the before the campaign started, and continue to do so, getting queries about the vaccinations, but helping people to book in and get their appointments ready for them and setting up those clinics. We were asking, just wanting to give people the jab, so that students and things like that we didn't have details for, we asked them to drop in. But there's been a lot of work getting that information from partner organisations, from the staff in the clinics, and certainly from HR systems and HR services, etc., and education, getting all the information from those partner organisations, and then from health and social care as well. They had to send their information in, and that was very difficult for them, because there's lots of little organisations that support our social care and care in the community and things like that, that they had to provide quite robust information that was difficult for them to collate.
As Becky mentioned, we have a large number of staff who are peer vaccinators for the flu campaign, but the requirements were significantly greater. There was approximately half a day's equivalent of e-learning which staff needed to undertake, some of that very specific with regard to the Pfizer vaccine, as well as the legalities and safety aspects of a vaccination programme. We also had competency assessments in practice, which we had to undertake for each vaccinator to ensure that they were safe throughout the whole premise of start to finish of somebody receiving a vaccine. Likewise, for those of us who were clinical leads, we had to be able to be competent and assess every single aspect, from somebody walking through the door, the vaccine preparation and reconstitution, through to administration, observation and discharge out of the clinic, along with follow-up. So whilst there were some key tools for us to undertake that, I would say a lot of the learning continued on a day-to-day basis in practice. We learned as the guidance changed, so communication was absolutely vital in terms of learning from other organisations. So our chief pharmacist regularly updated us with shared information across the ICS and also from the primary care networks, where we were picking up from that along with our executives who were feeding in. So whilst there was a training plan, I would say that the learning was more or less on a daily basis still continued for safety and improvement. The administration of the second vaccine to some degree was easier in terms of the actual practicalities of it. We were quicker, the systems we were more familiar with, staff didn't have as many questions necessarily because they'd had their first vaccines and were reassured about that. But then equally there was quite a lot of challenge and expectation as vaccinators and as clinical leads when the national guidance changed from 3 weeks to 12 weeks. Understandably, people's anxieties were raised, there was concern, so there was a lot of health and wellbeing support directed really in managing that, and also about ensuring that the vaccine was administered and administered within the timely manner as what we were expected to do, and that we didn't breach that.
The COVID vaccination programme is really, really high profile and really critical for our organisation. So I feel proud to have been involved in that. It is something very, very different to my normal day-to-day job. I have had massive highs and massive lows.
It's been very challenging. None of us have done it as part of our regular role. We don't normally work in this sort of situation. We have used skills, so I've used some QI skills to look at the best way of administering the vaccine, 1 or 2 vaccinators, and whether or not they can draw it up. But it's also been, like Jane said, it's been very proud to be part of it.
I felt very much like Jane and Becky, ups and downs, highs and lows. I think the first 6 weeks, actually, when we actually started the preparation in November 2020, when the discussions first started, I slept and dreamt COVID vaccines until we actually commenced on the 29th of December. And I think once we started and we got over those first few weeks of, getting more familiarity, things changing and learning, each day and each clinic was very different. There were challenges. It was extremely emotional. There were people who cried both with joy and just being overwhelmed.
When we started at Keepmoat delivering those first few vaccines, a lot of people felt quite emotional that it was like a light at the end of the tunnel starting on this process. So although it's been very difficult and a lot of things have changed very quickly, like the guidance and the ability to order the vaccine from the national system, it's been something to be proud of, to have actually made a real difference with people and how they can now start to come back to work and start to move about a little bit more freely as restrictions are eased.
It's been in waves of, yes, so I feel in control of this and it feels like it's all going to plan, to then moments of it's all going pear-shaped and actually how are we managing to do this. And I think how we manage to do that is everybody working together and supporting each other and working as well as we could with a lot of unknowns. I think it's really, I found it personally very uncomfortable working with unknowns. And as Lizette's already said, things changed on a daily basis, day-to-day basis. So what you'd put in one day was not fit for purpose the next day. And that was very, very frustrating at times. But when you reflect back on what we've done an absolutely magnificent job.
I'm really, really proud of Team DBTH, of our education team, of who have supported the assessment and development of skills. I'm really proud of every single person who has stepped up to vaccinate, the pharmacy team, the administrators, the marshals, estates and facilities for getting in and doing what we need, the procurement team daily coming with trolleys of equipment that we need, the gifts that we've received into the organisation to thank people, a card here, a biscuit there. But it truly has been a team effort, which I will always remember. I'm sure I'll reflect at some point and think, did it really happen? Because in over 30 years of nursing, I've never experienced anything like it, but I will always remember it.